So again, thank you for joining us. I'm going to introduce Dr. Katy White. She was born and raised in Banff, Alberta. She competed in 3-day eventing across North America and eventually trained young sport and race horses for sale in New Zealand. She continued to ride upon her return to Canada, where she completed an undergraduate degree at the University of Victoria and started working in veterinary clinics, including Burwash Equine, as a student to gain exposure to the profession. Katy's worked in a variety of areas of veterinary medicine, from small animal emergency practice to bovine medicine, rural mixed animal practice, and humanitarian veterinary work in Kenya. However, her passion for horses has never wavered. While earning her vet degree from the University of Calgary, Katy specifically pursued her interest in equine sports medicine through student positions and externships at referral equine hospitals in Canada and the US. She graduated at the top of her class from Calgary in 2019, and then moved to Colorado to complete a rotating internship in emergency and critical care, internal medicine, surgery, and sports medicine at Littleton Equine Medical Center. Following completion of her internship, Katy practiced for 2 years as an ambulatory equine veterinarian on southern Vancouver Island. Katy has a specific interest in lameness and sports medicine, although she enjoys all aspects of general practice. She particularly enjoys diagnostic imaging, including having experience in endoscopic procedures such as gastroscopy. When Katy's not practicing, she enjoys all aspects of getting outside, including skiing, hiking, canoeing, and mountain biking. We are thrilled that Katy has joined Burwash this spring, and I'm looking forward to her talk tonight.
Thank you again for all coming to join us at the Burwash Event Fall Seminar. The topic this evening, as I'm sure you're all aware, is regenerative medicine and orthobiologics. This might seem like big words, but we're going to get into that so they don't seem so scary as we go on. Dr. Lee introduced me so nicely already, but as she mentioned, I was born and raised in Alberta. I've traveled around a little bit throughout my education and early veterinary career before coming back to join the Burwash Equine team this spring. There's some photos there of adventures in Alberta since returning, including riding at the Ahatinda, canoeing on the Milk River, hiking in Kananaskis, biking and skiing in the Rockies, and in the bottom left there is myself and my husband with our dog and cat at our new house in Calgary. So I'm the face that you will see a little bit more when you're around the clinic, and now you know a little bit about me. Alright, so just a quick outline for the evening. We're going to start by talking about some common causes of lameness in horses, and what we've traditionally relied upon as treatments for that. Then we're going to move on specifically to regenerative medicine and orthobiologics and how those things might have applications in lameness. Specifically, we're going to talk about the commercial products that are available, including PRP, IRAP, ProStride, A2M, stem cells, and Lenovo. If you're not aware of all of these things, we're going to go through them tonight. There's not going to be a quiz at the end, but the idea is just to get everybody familiar with what options are out there for your horses, and we'll have a chance for summary and questions at the end. Alright, so the problem of lameness. This is a big problem. Doesn't matter if you're trying to go to the Olympics and jump a meter 60, or you just want to ride on the weekend. If your horse isn't sound, you can't do what you want to do. Obviously, it's a big part of equine health and wellness from an equine veterinarian perspective, and we very commonly deal with lamenesses that are caused by joint disease or arthritis and soft tissue injuries, specifically tendon or ligament injuries. Just a quick overview of degenerative joint disease or arthritis. Arthritis specifically means arth, joint. Itis, inflammation. If you've heard of osteoarthritis, that's just when the arthritis has started to affect the bone. But it's a disease that includes specific injury to the bone, cartilage, joint fluid, capsule, and surrounding ligaments of the joint. So it's a full encompassing disease, and it's super common in horses, estimated to be a cause of up to 60% of lameness causes in horses. There are many different causes for arthritis, including repetitive use, trauma or past injuries, genetic or congenital effects, and environmental effects. But all of these things lead to stresses on the joint, and then those stresses cause inflammatory cascade in the joint, where pro-inflammatory cells in the body, proteins, a specific type of protein called cytokines, all lead together in this cycle to further joint damage. For you as horse owners, this means that you have pain, stiffness, injury, poor performance, and then you come to us to try and fix it. But unfortunately, it's a degenerative condition that tends to get worse over time. So traditionally, our treatments for these joint diseases and arthritis have been aimed at reducing signs of pain and inflammation. So we're really trying to halt that inflammatory cascade within the joint. And that might be common anti-inflammatories like Bute, Prevacox, or Equine, or it might be more targeted treatments like joint injections with corticosteroids. We might use cushions or lubricants in the joints like hyaluronic acid or Noltrex at certain points. But ultimately, as I mentioned before, this disease tends to be progressive. It tends to be a degenerative condition. And so often we end up having to decrease workload later in life for these horses. There also can be side effects to these traditional treatments. So specifically with the corticosteroids, there are certain types that can cause what we call chondrotoxicity. So that's injury to the cartilage within the joint. So even though it's stopping the inflammation, long-term use can sometimes further the joint disease. In overweight or metabolic horses, we also sometimes see laminitis as a secondary effect of steroid administration, meaning that the cons are outweighing the pros. And then any anti-inflammatory has the potential to cause injury to the kidneys or GI tract. So horses that are prone to those things, sometimes these options are not as good for them. On the other side of the spectrum is tendon and ligament injuries. And so tendinitis meaning tendon inflammation, desmitis meaning ligament inflammation. And horses are pretty prone to these injuries because they don't have a lot of muscle on their lower legs. So they don't have much protection down there, and then they have all this extreme stress and strain on their legs during episodes of performance. Injury to these tissues can range from an acute tear or strain in the injury or in the ligament or tendon, or chronically inflamed enlarged tendons that just decrease their overall performance. They can be difficult to diagnose depending on the type of injury, and they tend to come with a considerable length of time in terms of layup and rehabilitation, meaning that your horse is out of work. And then, unfortunately, the healed tissue itself tends to be more prone to re-injury because it's not as strong as the original tissues. So our treatments for these traditionally have been focused again on kind of halting the inflammatory process, so decreasing that inflammation in the short term, and then by resting the injured tissues with a controlled return to exercise to try and improve the strength of that tissue through the rehabilitation process. So as mentioned before, they tend to never to be quite as good in terms of their strength and elasticity. So that's through a prescribed rest and rehabilitation program from your veterinarian, icing and pressure bandages to try and decrease the inflammation in the short term, and then sometimes supplemental therapies like laser therapies or shockwave to try and increase circulation through that more delayed healing period. But even with all of these things, we know that these horses are still quite prone to re-injury. So that leaves us as veterinarians and you as horse owners wondering what else can we do? Obviously, we've relied on these treatments for many years. That's not to say that they're not good and they haven't worked for lots of horses, but sometimes we're looking to our toolbox to try to find other solutions. And that's where regenerative medicine comes in, why we're all here tonight. So, regenerative medicine is medicine that aims to replace or regenerate human or animal cells, tissues, or organs, with the goal being that we want to restore or establish normal functions. We're not just stopping that inflammatory process, we're actually trying to get the tissue back to its normal. And orthobiologics are a specific type of regenerative medicine that is aimed at treating musculoskeletal injuries like arthritis, joint disease, and tendon and ligament injuries. Traditionally, regenerative medicine has relied more on trying to take tissue from another horse or a person and transplant it into that injured space and then have that new tissue take over. But we know now with research that that doesn't really happen in the body, and instead we're relying on this soup of anti-inflammatory proteins and growth factors that are within our regenerative medications to stimulate the body to try and heal itself. And that soup is referred to as the secretome, which we'll come back to as we go through the presentation here. So you can imagine there's lots of potential benefits to these medications. We're not just stopping that inflammation, we're trying to repair damage and create a more healthy environment within the body. We're still in the research stages of actual prevention of these diseases, and we can't actually reverse the disease once it's already started, but this is kind of the process through these initial regenerative medications of leading towards that. There have also been some more recent studies that certain regenerative medicines like Prostride and IRAP actually seem to have a greater anti-inflammatory effect for cartilage cells in cellular models, so potentially even better than steroids as an anti-inflammatory. We don't see that same chondrotoxic effect, so we're not getting the injury to the cartilage that might actually progress the disease in the long term. We don't have the risk of laminitis for our overweight or metabolic horses. And then we have those application in soft tissue injuries as well, where we want to try to improve the healing and decrease the amount of re-injury that we're having. And then generally, all the ones that we're going to talk about tonight have gone through pretty extensive safety studies, and so we know that they are safe to use. So within the realm of orthobiologics, there are two different arms to this: autologous blood products and stem cells. We're going to talk about both arms of this through the evening tonight. Specifically within autologous blood products, we're going to focus on IRAP, platelet-rich plasma, and Prostride. We're going to briefly touch on the alpha-2 macroglobulin as well. And then within stem cells, we'll talk about the difference between autologous and allogenic stem cells, different sources for them. But we're going to focus mostly on the autologous stem cells that come from bone marrow, because that's where most of the research has been that shows positive effects in horses. A couple definitions before we get too far into this. We're going to talk a lot about different products that are either autologous in origin or allogenic in origin. And autologous products are products or cells that come from the horse itself for use on that horse. So for example, we're pulling blood from the horse, we're processing it some way, and then we're using that in the horse's joint. The difference from that to an allogenic product is where allogenic products are pulled from multiple horses in a veterinary scenario under medical conditions, and then the pooled product, say for example blood from all those horses, is then processed to then make a commercial product that can be used in the field for a horse of a different origin. Mostly, the products we're going to talk about are autologous products. Those are the most common products that are available. That's where a lot of the research has been done. But I think as this grows as a field, you're going to see a lot more allogenic products on the market, and there certainly are more in the States where some of their regulations are a little bit different. So I do want to just bring those ones up as well, as they'll likely come on your radar. You've probably noticed already that regenerative medicine comes with a lot of big names, and then such it comes with a lot of acronyms. This is maybe stressful for the vet students and interns in the room who will be tested on this later. The idea is not for you all to know all these off by heart, and I'll go through them as we go, but just for you to become more familiar with them and for it maybe not to sound so foreign in the future. All right, so we're going to start now with autologous blood products. All right, so autologous blood products. These are regenerative medications that are obtained from the patient's own blood, and then they're comprised of either the plasma or serum, and potentially white blood cells or platelets that have been manipulated to release growth factors, nutrients, and anti-inflammatory proteins. When we spin blood, it's separated into three separate components, and that's what you can see on the screen here. So there's red blood cells, there's what we call the buffy layer, which is the white blood cells and platelets, and then the top layer is plasma or serum, depending on how we process it. Most of these autologous blood products are going to be a combination of those top two layers, so either the plasma and serum and the buffy layer, which includes the white blood cells and the platelets. And the general aim here is that we are trying to create a product that's going to have these growth factors and anti-inflammatory proteins that reduce inflammation, promote protection of intact tissues, and also regeneration of new tissues within these injured spaces, recruit stem cells or other regenerative cells from the body to those injured spaces, and then support the development of new blood vessels to bring new blood and other anti-inflammatory cells from the body to that area. There's lots of different uses for autologous blood products, whether that be from joint disease to soft tissue injury, or beyond sports medicine, but they're pretty variable in terms of their commercial formulations. We're going to talk about the most common ones tonight. Really depends a lot on the sampling and processing technique, which growth factors and proteins you're getting. And then there's also patient variability. So you can imagine that with these products that we're pulling from the horse itself, the autologous products, and then using on that horse, we're going to get different levels of proteins depending on that horse's health status. So their immune status, their age, what drugs they're on, if they've undergone any recent stresses like surgery or intense exercise, can all affect what we're getting when we pull blood from them. So we do have to look at kind of the full picture when we use these products. But we'll go through each one specifically as we go. We're going to start with PRP, but then we'll move on to the other ones that I mentioned before. All right, so PRP, or platelet-rich plasma, is the basically most common autologous blood product that's out there. And that's because it's been studied pretty extensively in human medicine, small animal medicine, and equine medicine for its effects. What it is blood that's been spun, and then it's concentrated to activate the platelets at levels that are higher than normal for that horse. And that specific activation of those platelets in high levels results in growth factors that are released to go into the area of injury and then enhance the body's healthy inflammatory cells coming to that area to help promote healing through new blood vessels and connective tissues, and then regenerate new tissues like skin or other cells. Each of these platelet-rich plasmas has a different level of white blood cells in them. It has been controversial in the past whether you want a high white blood cell count or low white blood cell count. Because of the high white blood cell count, we do sometimes see an initial inflammatory event within the space that can be detrimental potentially, but it seems like with the studies we're finding that that is really short term and it's really tissue dependent. So if you're introducing it into an area that's been injured, then you're going to find that it actually has more of a positive effect in the long term. And with the white blood cells present, we're going to get extra growth factors in the platelets. So we do typically use more white blood cell rich, platelet-rich plasma now. The great thing about platelet-rich plasma is that it can be performed stall-side or in clinic in about 20 to 30 minutes. So the blood is pulled from a horse in a sterile fashion. It can be processed in many ways. The one on the left there is a gravitational system where we're basically filtering out the platelets. The one on the right there is a centrifugation, so we're spinning the blood to get the platelet-rich plasma. Either way, you're going to end up with a platelet-rich product, but it does seem like the centrifugation systems are more effective at that concentration, and so that's the kind that we have for wash equine. In practice, most of the research has been around use of PRP in tendon and ligament injuries, and it has come with pretty significant research behind it to show support. So that picture up there is showing a horse that's having an ultrasound-guided injection of platelet-rich plasma into a lesion in the superficial digital flexor tendon. But basically the black hole in the tendon is at the end of that bright white line with the yellow star there, and that's showing the needle going into the hole, and then if this was live time, you would be able to see the platelet-rich plasma going into that hole, so we can provide really targeted treatment there. And then once that platelet-rich plasma has been injected, we see improved blood supply and strength of tissues. We see horses have an earlier reduction of lameness and then ultimately a shorter rehab, and we also see decreased re-injury rates in these horses. There's also a little bit of evidence for use of PRP in arthritis. Specifically in cellular studies, we see anti-inflammatory effects. It has been a little bit of variability in terms of clinical studies, and part of that comes from there being so many different PRP formulations on the market. But in general, we do see that in the long term, it seems to have an anti-inflammatory effect in the joint. There's just that bit of a risk of an initial inflammatory flare, especially in those white blood cell-rich products. So this is just a quick summary of PRP, and this chart is going to expand as we go through, so you can compare the products that we're talking about. But PRP has the most evidence for use in soft tissue injuries. It's an autologous product, meaning it's taken from the horse and used on that horse. We can perform this both in clinic and stall side at your barn. We're getting a product for same-day use, about 20 to 30 minutes for processing time. We get a single dose that needs to be used that day. We can't save it for later. And costs there is in the mid-hundreds to low thousands, depending on the procedure being performed and the amount of product that you need. All right, so moving on now to autologous conditioned serum. This is most commonly referred to as IRAP. It's kind of like the Kleenex to tissue type thing, but IRAP is named for that because it's named after a specific anti-inflammatory protein, the interleukin receptor antagonist protein. And when they first formulated this, they were really looking at that important protein. It binds to inflammatory proteins within the joint space and helps stop that cascade of inflammation. Once we really started studying it, we found that there's also a lot of other anti-inflammatory proteins and some growth factors present that have positive effects as well, but still named for that key protein, the IRAP protein. It's similarly pulled from horses. Their blood is pulled, and then we process it over a 24-hour period. It's incubated with glass beads that help to activate the production of that IRAP protein. And then we spin it and pull off the serum. You can see there that you're getting multiple doses when we're doing this. And those doses, because they don't have cells in them, like the platelet-rich plasma, can be frozen and used in the future. So the great thing about that is that with one pull, you're going to have multiple medications for your horse. When they did research on this, they really found that those multiple doses were the best way to do it as well. So most horses get a series of 4 injections about 1 week apart when they're having IRAP series performed. And when you're doing it that way, those studies show that you have improved lameness and range of motion in the joints after injection, improved cell parameters of health, less chance of an initial inflammatory flare than what we're seeing with Prostride. And then there's quite a long-term benefit to the improvement in leanness that progresses past when we see the IRAP protein still being present in the joint. There's also a little bit of evidence for use of IRAP in tendon and ligament injuries. Not as much as platelet-rich plasma, but there are some studies that support its use in terms of faster improvement from leanness and better ultrasound appearance when we're doing those ultrasound-guided injections. And then specifically for horses with suspensory ligament disease, there have been some case series suggesting that there's shorter rehab for patients that have IRAP administered in a series to them in combination with their rehab. So again, IRAP more for joint disease than soft tissue injury, but does have a little bit of evidence. It's also an autologous product, can be performed both in clinic and stall side. It does not have the benefit of being a same-day use product because it needs that 24-hour incubation period, but you get multiple doses. And then again, depending on the amount that you need in the procedure being performed, it's in the low thousands. All right, so now moving on to autologous protein solution. This is kind of the evolution from where we started with PRP and IRAP. It isn't just a PRP, and nor is it an IRAP or ACS, but it has a combination of properties from both. And the idea here is that we're creating an optimum concentration of those platelet-derived growth factors as well as the anti-inflammatory proteins like Prostride, or like IRAP, and having them both present in the Prostride. Similar to the other products, it can be processed stall side or in clinic, and it's ready in about 30 minutes for immediate use. So this is an example here of what that might look like, but you would have your blood pulled from your horse sterilely. We would spin it to get the platelet-rich plasma. Then it would go through a second spinning process with beads similar to the incubation beads that we use for IRAP, and then we would get a product that can be injected into your horse that same day. Because it's a cellular product, it can't be frozen and stored for future use. Prostride has evidence for both tendon and ligament injuries and osteoarthritis. Specifically in tendon and ligament injuries, we see the improved quality of the healed tissue, the decreased lesion size on ultrasound, and then improved elasticity in those tendons as well. And so you can imagine that that could potentially result in decreased re-injury rate. And then with arthritis, when we're using this, we're seeing improved lameness and range of motion by 14 days after injection. And that can last up to 52 weeks in the studies that have been performed. There is actually, interestingly, a study in humans where they did one single injection into knees with arthritis, and the people in that study were showing benefits for 3 years after a single injection. So potentially even goes beyond the 52 weeks depending on the horse and the severity of the disease. All of these products really depend on severity of disease. So we're going to have better outcomes with prostride, IRAP, and platelet-rich plasma when we're identifying issues earlier and treating them earlier. By the time you get to the point where there's lameness at a walk, or there's significant x-ray changes, or there's cartilage damage, then we're not going to see no effect from these things, but we might see less effect or for a shorter time period. All right, so again, prostride has evidence for use both joint disease and soft tissue injuries. It is also an autologous product that can be performed both in clinic and stall side. We get a product for same-day use. We get a single dose for use that day, not frozen for multiple doses in the future, and the cost is comparable to IRAP. All right, we're briefly just going to touch on alpha-2 macroglobulin. This isn't something that's widely available in Canada yet. More so talking to my colleagues in the States, this is something that's getting quite a lot of anecdotal support with veterinarians, but hasn't had a ton of actual published research out behind it yet. It's a protein that's present in the body that we are isolating and concentrating to help break down that inflammatory cascade. It's made specifically for joint disease. Again, blood is collected here, but instead of using that platelet-rich portion that we talked about before, we're taking the opposite part of the blood, which is the platelet-poor portion, and then we are isolating that A2M molecule for injection into the joint in high quantities. It's done on farms similarly to the other products or in the clinic. The benefit of this one is that you have something for use immediately, but also you're going to have multiple doses that can be frozen for future use as well. Again, primary evidence here is for joint disease and potentially even having some evidence for prevention of joint disease in humans and mouse models, but still waiting for that published research in horses. Here's just an example where we're spinning the blood to get that platelet-poor plasma, and then they have a filtration system to get the plasma with the high concentrations of A2M for joint injections. So primarily joint disease, an autologous product coming from the horse can be done in stall side or in clinic with same-day use, but also having the benefit of multiple doses that can be frozen in the future. Again, not available from our clinic at this time, and not very widely used in Canada yet, but talking to my colleagues in the States, coming out a little bit more expensive than our IRAP and our prostride products. All right, so that's one arm of the regenerative medications that we're talking about. We're going to move on now to stem cells. So stem cells are basically parent cells that have the ability to change or differentiate into other cells within the body. There are lots of different stem cells, and they come from lots of different sources in the body, but specifically with horses and musculoskeletal disease, we're focusing on a type of stem cell called a mesenchymal stem cell that has the ability to change into bone, tendon, cartilage, and fat. So specifically would have good use for joint disease or soft tissue injuries. There's lots of different sources for mesenchymal stem cells, including bone marrow, adipose or fat tissue, blood, and perinatal tissues. Primarily in horses, we're using bone marrow-derived or adipose or fat tissue-derived sources. Really more focusing though on the bone marrow-derived, as it seems that between those two sources, when we collect the bone marrow-derived stem cells, we get less cells at the beginning, but those cells are superior in their ability to change into the other cells that we want them to. So as I hinted about at the beginning, initially a lot of the regenerative medicine research was thought that we were going to take these stem cells, we were going to put them in the area of injury, and then they were going to become the cells that we wanted them to become, and they were just going to make everything better and reverse the disease. But it turns out that when we implant these cells, they really have a poor long-term survival in areas of injury. Instead, we're relying on that secretome or soup of these anti-inflammatory proteins and growth factors that we already talked about with our autologous blood products, but as even more enhanced in stem cells. And that soup is going to cause a changed immune response in the horse or the person, and we're going to have reduced inflammation, we're going to stop the death of cells, and hopefully stimulate the body to do its own regeneration. The ultimate goal here is that our healed product ends up being more closely resembled to the original tissue than scar tissue. So the picture up there is a wound model, but it also applies to soft tissue injuries or joint disease. You can imagine when we have a pathological scarring process, when there's lots of disease or infection present, the healing process is going to be affected. We're going to end up with tissue that's really weak compared to our original tissue. Under normal processes, we might have tissue that's a little bit better in terms of being healed, but still is going to be weaker than the original tissue. And then the idea with regenerative healing and our stem cells is that we're getting this really enhanced secretome, and that's giving us tissue that most closely resembles our original tissue, and still going to have better strength and elasticity and improved function. So I mentioned already that typically we're using bone marrow-derived sources for mesenchymal stem cells in horses. And that can either be from the sternum, which is being shown in this photo here, or from the pelvis. Sample collection needs to be done sterilely. It does involve more risk than we have with our autologous blood products. You can imagine a sterile blood pull from the jugular vein is something that we do pretty commonly as veterinarians. But you can see that's a pretty big needle. It's going into the sternum, which is right beside the chest, which is right beside the lungs and the heart. So this is typically something that you want to have done in a clinic setting, not out in the field, where we can be as sterile as possible and have the best control over the situation to help minimize the risk. Once we've got our sample collected, we have a couple options for what we do with that sample. The top one there is demonstrating what we call a bone marrow aspirate concentrate or centrate. And so that's where we're spinning it Saul side, similar to our PRP, and then we're using it immediately for use on an injury, like the ultrasound-guided injection that you can see there, or what we talked about with the PRP. The great thing about this is that when the horse has an injury, we can pull the blood from them, we can sample and get the product that same day, and then use it the same day. But we know that the concentration of stem cells specifically is quite a lot lower than it is in the bone marrow that we culture. And so we're relying more kind of on that soup of anti-inflammatory cells and proteins. The alternative is that we send off that sample for culture and expansion at a lab. And that takes about 2 to 4 weeks. And when we do that, we get a true growth of stem cells that comes back in multiple doses, and then we can use that over a series of injections to try and help heal the tissue. And we do know that these stem cells seem to have a superior ability in terms of healing tissue to become more similar to the original tissue than just the aspirate concentrate alone. But it has the downside of having the delay between initial sample collection and treatment, and also comes with a decent amount of cost. So most of the research for mesenchymal stem cell use in equine practice is for tendon and ligament injuries. We talked about those intralesional injections with the ultrasound guidance. Alternatively, we can also do perfusions in veins or arteries. And so that photo there is showing a horse that's having a catheter placed with an ultrasound into a vein, which you can see there in B. And then C is showing the stem cells with contrast going down the vessels to the body. So you can imagine this would have applications when there maybe isn't a hole in the tissue where you can actually go in and put your stem cells in there, but you still want to have the benefits to an area that's inflamed. And this research behind stem cells is pretty remarkable. The repaired tissue is quite a lot more similar to parent tissue than to the injured tissues that we see. Has a lot more improved strength and elasticity, better blood supply, decreased fibrosis or scar tissue. And specifically, there have been some studies that show real significant decreases in re-injury rate. So, for example, one study of horses that have bowed tendons or superficial digital flexor tendon injuries, their re-injury rate was about 80% in race horses, and that went down to 13 to 36% after stem cell use. There have also been some studies to show that those bone marrow-derived mesenchymal stem cells are superior to PRP or the adipose or fat-derived stem cells, specifically for soft tissue injuries, but the PRP and the adipose-derived stem cells did actually have effect greater than the control. So we still know that those are effective in terms of helping healing, but maybe not as good as the bone marrow stem cells. Finally, there is some use also for osteoarthritis. We know that there is improved signs of disease, cellular health in the joint, less clinical signs like lameness, but there is a similar risk to our PRP products in terms of a short-term inflammatory flare, and that seems to be worse with the allogenic products than the autologous products. So when we're pulling from the horse itself, less likely that they're going to have an inflammatory flare compared to if we're using a product that came from other horses. All right, so stem cells, mostly evidence for use in soft tissue injury, but also some evidence for use in joint disease. Can be either autologous or allogenic in origin. There are allogenic sources out there of more stem cells, but primarily we've been using more of the autologous bone marrow products. This is one that you want to do in clinic because of the risk that we chatted about. And then depending on if you use the bone marrow aspirate centrate, that can be used same day. You get a single dose for use that day, versus if you send it up for culture, there's that 2 to 4 week time period, so that we get multiple doses to use. And this is still an area that's quite new. It's an area that's being developed, and kind of being at the cutting edge, it does mean that it comes with quite a lot more cost associated with it as well. And then really quickly here, I'll touch on a product called Renovo, which is an amino allograft. So it's not technically a stem cell product, but it's an allogenic product that's obtained from amniotic tissues and fluids, which have stem cells in it. So the idea is they're trying to kind of harness that. This is coming from mares and foals in a controlled situation with veterinarians where they're healthy births, and then they're collecting these tissues to make this product that has high levels of things like IRAP and other anti-inflammatory proteins in it. And they promote that it has decreased variability in the product because it's coming from multiple horses, and they can guarantee that it has the high concentrations of the IRAP proteins and other proteins in it. And then there's the ease of use, and that you don't have to pull blood from your horse that same day. But this is one similar to the E2M that I mentioned earlier, where really we're still just hearing anecdotal reports for how this is being used in practice. We're trying to wait until we get more actual studies with true published research that support the use, but it does seem to be coming down the line, so it's something you might hear of in the future. So it's the one allogenic product that we've got up there, and like I said, still kind of waiting for that research behind it, potentially some use in joint disease and soft tissue injuries. Has the benefit of being either stall side or in clinic with same-day use in multiple doses, and then depending on the amount, it seems like it's in the mid hundreds to low thousands, and depending on the amount of injections or procedures that you have being performed. All right, so that was a quick kind of overview of regenerative medicine. Obviously, there are lots of different options out there, and the idea was just to give you a sense of what might be an option for your horse. It's important not to get caught up in the hype. There's tons of these products out there. I mentioned the ones that are most commonly available, that we use at Equine and that we have good success with, or that you might see coming down the pipeline in the future. But you might also hear about other products from people in the horse world. We all know horse people like to talk. Basically, we're here to help you decide what's best for your horse. And the whole team is on board, whether that's from regenerative medicine for sports medications or reproductive therapies or laminitis and feet problems. You know, eventually there's going to be research on all of these areas with these products, and we have an amazing team at Equine that can help guide you in these areas. The deciding factors for musculoskeletal injury specifically are going to be what kind of injury you have, what kind of treatments you've done in the past, how severe it is, and then more practical things like the cost, the ease of collection, preparation, storage, if you need multiple doses for your horse, and all of those things will come into consideration when we're coming up with a treatment plan unique to your animal. I mentioned already that there's lots of other areas of research. I kind of hinted at it with the repro and the laminitis and corneal ulcers and all the rest of it. So, like I said, this is a growing field, and you might find that regenerative medicine becomes something that is in your veterinary toolbox in the future. And with that, I'd like to welcome any questions. I thought it would be good to have this chart up in case anybody wanted to go through it. So, yeah.
So for the autologous some of these performance horses to meet, because the blood is going to be different in a horse that's healthy versus one that's injured. So is there any research saying that maybe blood that's going to be available for multi-use doses to be pulled when the horse is healthy, like to have blood stored from a healthy horse
Certainly,
to use for something like that versus waiting until it's already injured? Like for some of these, well-bred, higher performance horses, is that something that's going to be done or recommended to have some blood stored to be able to use for this that might work better than versus pulling it when the horse is already injured?
Yeah, that's an excellent question. Did everybody hear the question? Yeah, perfect. We find, it seems so far in the research, and this is a growing field, but a specific episode of a joint injury or a soft tissue injury probably isn't going to result in enough systemic inflammation that the amount of anti-inflammatory proteins that we're pulling from the blood are going to be changed. But we do know for sure that episodes of extreme stress, so like undergoing surgery or in racehorses when they race the day before, like they go to their full VO2 max performance level, that those horses have decreased numbers of those proteins, and also certain drugs. So drugs like bute and vanamine, certain sedative drugs can affect the amount of those anti-inflammatory proteins that we see in the blood collected after. So it really does need to be something that we're planning, not kind of doing in a reactive measure. And so in terms of having a plan, if it was in the budget for your horse to know, like, I know he's super healthy right now, I want to have this pulled so that I have this option in the future, that's totally reasonable. Though if, say, all of a sudden he had a soft tissue injury and we needed to pull some blood from him, that probably wouldn't be enough to affect the product. But say your horse was going to go for surgery, you probably would be pulling blood beforehand, or you would be having a drug washout period beforehand, that type of thing. Yeah?
I know with typical joint injections and whatnot, we give them a period of rest afterwards, sometimes 4 days, 10 days, depending on the injection. So my first question is, with all of these treatments, is there a similar time off period between treating the horse? And then another question that might be tied into that is like, with a drug like Osphos, I think it's something like 30 to 90 day window is where you see the best benefit or something like that. Is there a best benefit where we see the ideal benefit in the timeline of these injections?
Yeah, that's a good question. Did everyone hear that one too? Yeah, perfect. So for sure, it depends a lot on the type of injury that we're dealing with. So for example, let's say we have an acute injury to a joint or an acute injury to a soft tissue injury. Or to soft tissue like a ligament or tendon, then our time off after administration of one of these products is probably going to be a little bit longer. So for example, to a joint with those IRAP series, if you're doing it for a specific injury to that joint, you're probably going to do your series once a week for 3 to 4 treatments and have them resting during that time period or on a prescribed rehabilitation program during that time period. When they're in performance and we're doing this more in terms of trying to keep them sound and keeping them in work, then that's where something similar to what we see with our corticosteroid injections, where maybe they're having, a few days to a week off after injection, still recommended just to give that joint a chance to react to what we're putting in there, but potentially not like weeks and weeks off. And then the second part of your question was about that time period.
Yeah.
And so the best research study about that is about the ProStride product, and they see the benefits start to show at 14 days after injection. So it does seem to take a little bit longer to see effects than we might see from our steroids, but then those effects potentially could last longer, and that's kind of where the research is still out there.
Next question.
Yeah?
Is ProStride something you inject right into the injury, or is it like so it's not just a...
Yeah, so ProStride can be injected into joints, it can be injected into a lesion, it can be injected into a tendon sheath.
Okay, so it's not like a whole body thing?
Correct, yeah. Not like a Legend or an Equine where we're giving it in the vein or muscle and then it's going through the whole body.
Okay.
Yeah.
If you were competing at like a higher FEI level, are all of these legal, or is there a time period that you can or can't for competing?
Yeah, Yeah, with it being a newer thing, we're still kind of waiting to see how the FBI is going to respond to a lot of these things, but lots of them, like, you can't actually test for them. So there are still rules about like how far out you can do joint injections and things like that, but in general, no.
My background is more human than equine, but these products have not been in humans. Have generally a striking change in the way we manage these conditions. Do you think there's a difference between equine injury and human injury in the place of PRP?
Yeah, it seems like certain things like PRP, we've seen more variable response in, for example, joint disease in horses, and in people too. I think the research shows that it's been a little bit variable. But then some of these other products like the autologous protein solutions, so ProStride, and some of the autologous condition serums, it seems like some of the human research that I read has been pretty positive, though it's still in the early stages there. In terms of comparison of horses and humans, you know, we do share a lot of the same general anti-inflammatory mechanisms and proteins and all those things, but we have the unique situation in horses that a lot of them are really performance animals, and we're putting quite a significant amount more stress and strain on these joints than the average person does, and so then we're potentially reaching for these products maybe more often or more frequently than would be in the average human population.
For the osteoarthritis type issues, it looks like the IRAP ProStride kind of aimed at that specifically. Is there a difference in the long-term effectiveness of one over the other?
The studies on it are really dependent on the severity of the joint disease. And that's kind of where the breakdown from research to clinical practice goes, right? Because in clinical practice, they'll often study these horses for, 30 weeks or 50 weeks after, and then you never hear from that person again in research. Whereas in practice, we have these horses that we know, okay, yeah, for this horse, the ProStride is working great. We haven't had to inject them in a year, and they still look fantastic. Or his joint disease is more severe, and he's in more work than the average horse, or we're asking more of him, and so then that's where sometimes we're finding that we have to administer things more frequently, so in the 6-month range or something like that. But again, it really seems to be horse and injury specific.
For your joint disease, with your IRAP and ProStride and stuff, would one of those work better in combination with your corticosteroids?
It's a good question. We typically don't use corticosteroids with our regenerative products because they're going to have such a strong anti-inflammatory effect that they're actually even going to kind of negate the effect of what we're trying to do with our blood products.
Being staggered.
Yeah, but sometimes exactly we might find that a horse does well with having a joint injection of steroids or something like that, and then using the ProStride to extend the time between when we need to do the steroids and staggering them that way.
So how close together could you do that? Like if you didn't just injected the joint or whatever a couple weeks back, how soon could you go with ProStride?
I probably would, depending on what type of steroid we were using, would be giving them like a good washout period from that steroid so that you were having the maximum effect of your regenerative medication. I don't think there have been actual studies around that, but probably about a month, depending on the average steroid you're using. Great. Well, I'll be around if anyone wants to come and talk to me.